if you did that, then you would avoid the possibility of getting another double merle, such as Justin. And if you were to breed to a solid-coated dog, around half of the puppies would be merle like Turtle, and half would have the solid coat. And the other thing you want to avoid is breeding Turtle to a cryptic merle.
Cryptic merles occur rarely, but breeders need to be aware that this type of dog exists. Research has shown that some non-merle dogs can contain the retrotransposon. A dog who is a cryptic merle will be phenotypically normal, but in fact contains the sign insertion which makes it genotypically a merle. The notable difference, however, is the poly A tail that is associated with the sign insertion. The sign in a non-merle dog has a much shorter poly A tail when compared to merle dogs. The difference is approximately 60 nucleotides versus approximately 100. So, from this information, we can conclude two things. First, the presence of the sign element is necessary but not sufficient to cause the merle phenotype, but a poly A tail of certain length is required. Second, since the poly A tail can be expanded in the germline, it allows a mechanism by which non-merle dogs can produce merle offspring. There is a simple genetic test that can be performed for approximately $85. Owners must send a blood sample of their pet to be tested in order to determine if their pet is a cryptic merle.
Well, that's great to keep in mind. But what about Justin? What can we do for him?
Unfortunately, there are no treatments that we can do for Justin at the moment, but what we can do is assess the full extent of his blindness and deafness. So from what I see, Justin has very limited vision, if any. And also, like Joanna has mentioned, we should prevent future breedings that might produce double merles.
So we should neuter him.
Yes. Now, as for testing his hearing, it's a little bit more complicated to fully assess. The simplest way is to just watch his behavior as he reacts to stimuli that he can't see. But this isn't very accurate for unilateral deafness. However, in this case, just based on the history you've told me about Justin, I think it's safe to say that he's deaf in both ears. We could perform a diagnostic test to be sure, also to test for unilateral deafness in Turtle if you're interested. It's known as Brainstem Auditory Evoked Response, or BARE. This is a much more complicated procedure, and we would need to refer you to a specialist. Studies have shown that about 1/4 of double merles and 3.5% of heterozygotes have some level of deafness ranging from mild to severe. In some cases, humane euthanasia might be the best option. Justin to live with his conditions.
Well, you've given me a lot to think about. Thank you very much for your time.
You're very welcome.
I should get back to work.
So we've learned a lot today about the merle condition. Why don't we take a moment to review some of the main points? The merle coat pattern is characterized by patches of diluted pigment in combination with normal melanin and is found in many breeds of dogs. The merle condition is caused by an autosomal incompletely dominant gene, where heterozygotes exhibit the merle coat pattern and homozygous dominant dogs are nearly solid white. Both heterozygotes and homozygote dominant dogs are associated with many auditory and ophthalmologic defects. The importance of understanding the merle condition is accentuated by its similarity to the human condition known as Waardenburg syndrome. The gene responsible for the merle condition, SILV, is found on chromosome 10, where a sign is present at the intron 10 exon 11 boundary. The SILV gene is involved in melanin production and deposition via melanocytes. Disruption of normal SILV gene expression thus leads to pathologies of the ears and eyes, such as those seen in the merle condition. Diagnosis is made primarily based on the history, phenotype, and physical examination of the individual. Some medical and genetic tests are also available. Although there are no specific treatments for defects associated with the merle condition, owners can do their best to optimize the quality of life for their dogs. Unfortunately, oftentimes humane euthanasia becomes an option. Therefore, responsible breeding and ownership are strongly suggested. That's all for this episode. We hope it was as helpful for you as it was for Amanda and her dogs. Join us next time for more Canine Conundrums. So why don't we get... So why don't we send the vets in and get started?
Okay, whenever you want to start.
Okay.
Oh, I think it's your line. No, it's
She
your
said
line.
she was gonna ask, like, what she can.
Oh, right.
Yeah? Okay.
Yep.
We were wondering if you could explain the Merle condition. What am I saying?
Streptococcus infection. Ooh, that's a cat. So.
Sorry.
He's a good dude. He's a key.
And let me know. I should get back to work.
Okay, let's go. So how does that make you feel?
I can't, I'm like laughing. All the years in the hands of an angel in my hand.
So to test Justin's vision, first I'm just
Justin.
in some cases, humane euthanasia might be the best option.